Well, good evening, everyone. Welcome to tonight's live weight loss question and answer seminar. I'm going to do a quick introduction with both Dr. Chris McGowan, based out of North Carolina, and Dr. Lindsey Merritt, based out of Jacksonville, Florida. As you can see, there's some Q&A. There's a little slot where you can actually input your questions. I will go through those as we go through the seminar. So just throw those along and we will answer those as promptly as possible. And if there's any questions, just raise your hand and we will help you out as best as we can. With that being said, Dr. McGowan.
Thanks, Chuck. Appreciate it. Did you want to give some intros, introduce yourself to the audience?
Oh, that's a great, I
Who are
appreciate
you,
that.
Chuck?
Yeah, so I am Chuck Denolfo, the Chief Operating Officer of Bariendo. I've been with the company for 2.5 years, been in the weight loss business industry for, oh my God, probably 26 years. Certainly, it's a privilege to be with both Dr. Chris McGowan and Dr. Lindsey Merritt. Collectively, between the two of them, they've probably have done easily over 5,000 endobariatric procedures. When it comes to expertise, this crew is top in the entire country. It's a pleasure having all of you with us tonight.
Thanks, Chuck. Yeah, and
And the
those of you who
questions
are
are already coming
joining,
in.
yeah, we appreciate that. What we're going to do is I will give just a little bit of introduction, kind of set an agenda for the evening. We have an hour together, up to an hour together, and really what we want to do is answer your questions, anything on your mind, anything is fair game in the weight loss realm. I think we pose this as what's the best treatment for you as an individual, and we're going to walk through some options and answer questions. Go ahead and start putting your questions in the Q&A section as you are. I see those, and we will get to them as we get along here. And what I'm going to do though is to start, I'm just going to share my screen and offer some intro slides. And then we'll get to questions. So thanks for everyone who's joined us. We appreciate it on an evening. Definitely appreciate you being here. First of all, I didn't want to leave Chuck out, so put your head in there, Chuck. I hope that's okay.
Appreciate that. I
All right,
appreciate that.
but we're gonna get started with here's the if you didn't see it, if you're on your phone and you're looking, there's a little Q&A icon. Don't use the chat. I mean, we'll see that, but if you use the Q&A, that comes right to us, and we can answer those questions. So thank you for that. Quick agenda. This is like a few minutes. This is not a lecture, but I want to give just a brief overview of current weight loss options. Then we'll talk about the endoscopic treatment specifically that we specialize in here at Bariendo, and then the open Q&A, which is going to be the fun part of this. Treatments this year. One thing that we tell patients, it's the best time ever to be seeking treatment for weight because we have so many options. It's not even close to what we've had in the past. And if we were to look at this as a pyramid, at the very top is surgery. We know that's still the most effective treatment. About 20 to 30% of your body weight would be the average weight loss. But if this was actually to scale, surgery would be the very tip of that pyramid, though, because very few people actually utilize surgery. And we understand that. Not everyone's interested in a traditional surgery, which is why we've seen the explosion of endoscopic treatments, pharmacotherapy, weight loss medicines, which can produce the endoscopic approaches 10 to 20% weight loss. So we're really close to, if not matching, surgical weight loss. And then medications a little bit below that in the real world, but still very significant weight loss. And then at the bottom, the foundation is still lifestyle modification, diet and exercise. We've all tried these things many, many times. We know that in general, they're not that effective in the long run. So we're going to focus on endoscopy and pharmacotherapy in the next just couple of minutes. And really what I want to do is set the stage for our conversation, our discussion, topics that we can talk about. If we look at the endoscopic weight loss procedures, the main ones for patients who have never had a prior procedure or surgery would be the ESG or endoscopic sleeve gastroplasty, what we call ESG stomach tightening, where we're making the stomach smaller from the inside, and a gastric balloon, and we'll talk a little bit about that. ESG is our main procedure, and what this is a 1-hour non-surgical procedure where we're reducing the stomach by about 70% in size from the inside with an endoscope. As Chuck likes to say, from a football to a banana, if you've seen his Instagram reel. And that is a really good description because the stomach is a large, stretchy football shape to begin with, and we're narrowing it down to a banana shape, but without any external incisions. That means you're going to eat less, you'll feel less hungry, and you'll lose about 18 to 20% of your body weight at a year. Some people lose more, some lose less, but somewhere within that average range. And this lasts. We now have data. 10 years showing persistent weight loss, which is fantastic. We have plenty of studies at 3 to 5 years, so we know it's a durable, lasting procedure, and it's really safe and a quick recovery. And I think if I would highlight two things about ESG, it's the safety aspect because we aren't cutting anything, removing anything, rerouting anything. The complication rate is very low, 1% or less, and 2 to 3 day recovery is quite typical. That really distinguishes it from the surgical treatments. I know you all have a lot of questions about ESG, I imagine, so please put those in the Q&A and we will answer those. Gastric balloons, very different, completely reversible. This is really for someone who wants nothing altered long term. We put a balloon in, it stays in for 6 months, you feel full, you eat less, you lose about 10 to 15% of your body weight. So very different than the long-term ESG procedure, completely reversible. Now what if you've had a prior surgery, like a gastric bypass or a sleeve gastrectomy? We can also revise those. So if you're someone who's experienced some weight regain, that's quite common, we know. Obesity is a long-term chronic condition. There's no shame in that. But if you do regain weight, we can tighten things up endoscopically, again, not with surgery. So we tighten it from the inside with an endoscope. And so that's another category of procedures we specialize in. And then pharmacotherapy, medications. Sure, many, if not all of you in attendance have tried more than one, thought about using one, and that's understandable because these have completely changed the field. The FDA approved options right now are Wegovy and Zepbound. There are others indicated for diabetes, but in general, these are weekly injections. Pills are coming. An oral form of semaglutide is coming any day now. And so there's a lot of advancement going on with weight loss medicines. But the general themes are these have to be continued long term. We know that. If you stop them, you'll experience weight regain. Weight loss in the real world, it's about 8 to 15% at 1 year. Side effects are common, but generally improve over time. And comprehensive support is essential. That's true with all of these treatments that I mentioned, but absolutely true with medications. You can't do it alone. So those would be the main categories that we offer in our program. Who are we? Where can you find Bariendo? So Dr. Merritt's in Florida, in Jacksonville. I'm based in North Carolina. You can see the number of centers that we have, and we're growing monthly. And so we are really trying to expand access to these very highly specialized treatments throughout the country. Who's our team? Here you can see all of our doctors and our nurse practitioners, physician assistants, dietitians. So as a patient, this is so important. It's really essential that you have comprehensive care. So you work with nurse practitioner, physician, dietitian, health coach, and then you have your navigators and coordinators. So these are some of the faces that you might meet with our team. Okay, that's it for a little intro overview. And now we're going to get to questions. So I'm going to stop sharing, and Chuck is going to lead our Q&A session. And
Yes,
again,
where to
keep
start?
posting.
There's a lot of questions that have been coming in for both of you. So let's start off with the first one that came in. This is from Kara. I want to travel for my procedure. How long do I need to stay in town? Is it safe to fly home?
Lindsay, do you
Dr.
want to field that since I've
That's
been
an easy
talking?
one. Yes. So thanks for that overview. That was awesome, Chris. So in terms of traveling for your procedure, totally reasonable and safe. And actually, a majority of my patients currently do that. So typically arrive the evening before or the day before, arrive in town, so that you can get into a hotel, be comfortable, and then, come to the hospital for the procedure day, and then you go home that same afternoon. So you'll go back to, let's say, the hotel if you're traveling. Some patients decide, if they're driving to drive home a couple of hours that afternoon. Other folks decide to stay overnight and then head home the next morning. But in terms of flying or traveling within 24 hours after the procedure, patients do it all the time.
Okay, thank you. All right. So the next question is from Chandra. And I apologize for everyone if I'm mispronouncing people's names. I do apologize for that up front. And the question is, should I try to lose weight before my ESG?
Excellent question. I'll take that. Generally, I'd say no. And this is a little different than if you were to have a traditional bariatric surgery like a gastric bypass or a surgical sleeve. It's generally required to lose some weight before that. You might do 2 weeks of a liquid diet. That's primarily to shrink the liver down, actually, so that the surgeon can get their tools to your stomach. We're working through the mouth. with an endoscope, it's not applicable. So we will ask you to be on liquids for 1 day before the procedure. That's just to make sure your stomach's empty. There's really no reason to lose weight ahead of time. Generally speaking, I would encourage my patients to come in strong. I don't need you losing weight beforehand. You're going to lose that same amount of weight after the procedure and a lot more. There might be just a couple scenarios where our procedure centers may have an upper limit for a BMI, and we may work with you to make sure you're below that number. That would be probably a special circumstance, but generally speaking, no. Go ahead and come in strong. No need to diet beforehand. We're going to be working together for a whole year on this.
Yeah. Well, thank you for that question. And hopefully it answered your question as well, Karina. She had the same one. And so let's go with the next one is, can I get pregnant after the ESG or balloon?
I'll take that question. Um, so regarding pregnancy, part of the weight loss journey is to optimize your health, and for some that looks like becoming as healthy as possible so that you can become pregnant and have the healthiest pregnancy possible. So when we're helping prepare you for that, we want to have you undergo your weight loss procedure, whether it's an ESG stomach tightening or the intragastric balloon, help you for that first, in the case of the balloon, 6 months, or ESG 12 months, help you achieve the weight loss that gets you closer to your goal, where you're in a much healthier place to become pregnant, and then carry that out as safely and healthfully as possible for a mom and the baby. We don't advise pregnancy within the first year of the procedure, because as you're as you're losing weight, we don't want to then have kind of counteract that and have you needing to gain weight for a pregnancy. So immediately after the procedure, it becomes complicated. We like to wait that full year afterwards and have somebody really level out and achieve their healthy weight in anticipation of a healthy pregnancy.
Okay, thank you. All right, Dr. McGowan, we have a few questions about GLP-1s here. And the first one from Juan is, do you have a protocol for taking GLP-1 injections post ESG?
Yeah, okay. Well, let's talk about that. We know that most of our patients who have an ESG have previously been on a GLP, or maybe are on one or want to get off of one. So this is a really common question that we get when we're meeting with patients. Generally speaking, you do not need to continue a GLP medicine after the ESG procedure. Why? Well, we know that ESG is really effective. It's going to reduce hunger. You're going to lose that average of about 20% of your body weight. So the most patients will be able to come off of that medication if they desire to do so. And I'd say most people probably do. If you have diabetes and you're taking Ozempic or Mounjaro for diabetes, we may encourage you to stay on it, because that's obviously treating a separate condition and it can be complementary. But you absolutely do not need to use a GLP after the ESG procedure. We know there are some centers who are very proactive about using GLPs, but we know that the ESG procedure itself is highly effective, and that's the tool, when you're going down that path. So that would be our general recommendation. Now, a couple other scenarios. If you're at a very high BMI and really desire to lose much more, or need to lose much more than that 20% average, we may want to combine with a GLP, but usually that's going to be later down the line. Once you're months after the procedure, we may talk about adding something on. Definitely not right after.
Okay. And I'm going to stick with you, Dr. McGowan, on this one. It's more of the GLP question. This is from Linda. It seems that people who use GLP-1 meds have problems with bowels, diverticulitis, and then surgery to repair that. Is that true? And what are the long-term effects of using these kinds of drugs? Also, what are the effects on the body? Good question.
Yeah. So the GLPs affect the entire body. There are receptors throughout your body. We know they work for weight because of the receptors in the brain and in the stomach. They suppress hunger through the brain. They slow down stomach emptying, which is why you eat very little and feel full, but also why you have those side effects. So medicines like Wegovy and Zepbound cause nausea because of the slow stomach emptying. They also slow down the whole digestive tract for many patients, so constipation is really common. Other patients have diarrhea. These are all the most common side effects. As far as diverticulitis, I don't know that that's really been shown to be directly related to the medications, but the fact is you can have a lot of digestive side effects from these. They aren't permanent though. There's really no evidence to say that if you use a GLP and stop it, you'll have long-term bowel effects. So really, it's just when you're using that medication that you could potentially have those side effects.
Okay, thank you. All right, Dr. Merritt. This one's coming from Jenna Michelle.
Mhm.
Can I lose too much? I don't want to look sick.
That's a great question. Obviously, depending on the weight loss tool that someone chooses, as Dr. McGowan presented, we're going to lose different percentages of total body weight. So, with something like the ESG gastroplasty, we have an average total body weight loss of 18 to 20%. There's no reason that a person would continue to lose weight beyond that without also doing some extreme other measures such as extreme dieting long after the procedure or something that's causing the weight to continue to kind of plummet. We expect that for most folks with a starting BMI of about 30 or above, we expect for that 18 to 20% healthy body weight loss, and again, no reason for it to continue going down. Unlike say compared to like a Roux-en-Y gastric bypass, where it can become a problem where a person really is suffering from malabsorption or other, vitamin and mineral deficiencies that can really cause long-term problems. We don't see those with the ESG stomach tightening.
Okay, thank you. Dr. McGowan, this one is definitely yours. I'm going to try my hardest. Delisha, do you perform fundus ablation?
Okay. Yeah. Fundus ablation, for those who aren't familiar with it, or what we call gastric mucosal ablation, still an investigational technique. It's something that I've personally been heavily involved in the research side of for years now. It's a really promising area in the field, and I've actually treated many patients in the past through research protocols with these techniques. Here at Bariendo, we do not currently offer this. I would say stay tuned. It's something that we anticipate will be integrating into our practice at some point in the future, but this is because it's investigational. We want to be really careful about how we're treating patients and setting this up within a research infrastructure. So I'd say more to come on that, and you'll also be seeing results from other centers around the world who have been performing these procedures as well. So definitely a really interesting area, exciting area right now.
This next question, if you don't mind, I may interject. If you have anything to add, that's great. This is coming from Nicole. She says, my husband has pretty good credit. He's applied for me for the procedure. They only approved $7,000. Where does one's credit score have to be to get approved for the whole 13,000? And what I'll say is it does vary because there's different lenders. We do work with Cherry as well as Care Credit. My recommendation would be to call one of our patient navigators. They can assist with that. They have all kind of they've been working with us for such a period of time that they can assist to try to really help you out with one of those providers. So that's what I would recommend. Do you have anything to add on that? That one's a little bit of a trickier one because everyone's credit is a little bit different, and there's different things they do weigh when they assess those things.
Yeah, that's your territory, Chuck.
Okay. All right. The next one, Dr. Merritt or Dr. McGowan. Let's go with Dr. Merritt on this. How soon can you work out after ESG? And who is the physician in Detroit? The physician in Detroit is Dr. Mustafa Husseini, who is a Harvard fellow. So, a fantastic physician. But Dr. Merritt, if you want to add some context around working out.
Absolutely. One of the awesome things about the ESG is that a person can start being active, start their exercise program the day after the procedure. There is basically no downtime. So we strongly recommend being active that very next day after the procedure. Things like walking, body weight exercises, again, right away are perfectly safe and actually recommended to do so. We want to prioritize using your muscle and building your muscle so that your body in that calorie deprived state post procedure is preferentially burning fat and you're able to maintain more of your muscle mass. So we definitely encourage exercise as soon as possible, as soon as you're feeling up to it. And then as the weeks go on, following the procedure, we could increase the amount of exercise and certainly, the weight, body weight exercises and all of that.
I'm going to stick with you, Dr. Merritt, on this. Juan has a question. There are some things that you can't do during the 6 week period after the procedure, but is there anything that is forbidden after the 6 week period?
After the 6 week period, the stomach should be fully healed. So that's when the diet is really liberalized back to normal consistency. And in terms of activity restriction, there basically is none. So at the 6 week point, there's nothing that a person can't do. You might notice some things in the recovery period where you have, let's say, a new food aversion. I've heard patients tell me that, they used to like eating eggs and for whatever reason after the procedure don't care for eating those same types of foods, or with sweets. That's a big one with chocolate. So it might be the case that your tastes change or things like that, but there's nothing that's off limits or contraindicated after that 6 week point.
Thank you. All right. We will go with Dr. McGowan. Brian has a question, and this is, hi there. Curious how this is for someone who has been on GLP-1s and it didn't really work for them. Looking at the ESG, do you take GLP-1s with the ESG, or does ESG work on its own? I'd like to lose about 60 pounds and keep it off and not rely on medications the rest of my life.
Great. Hi, Brian. Yeah, no, that's really important. So GLPs don't work for everybody because no treatment works for everybody. And we know there is a certain percentage of patients who just don't respond well to any given treatment, and that is true of medications. The perception, if you just see what's in the news and celebrities and such, you'd say these are miraculous, they work for everyone. It's not true. So if you've used a GLP and haven't responded well, you're not alone. And so transitioning to or stepping up to another treatment path like an ESG, it makes logical sense. It's a completely different process and pathway. So we would anticipate you'd have that normal average response to the procedure, even if you had no response to a GLP med. And absolutely, we wouldn't combine the ESG with a medicine when the medicine didn't work for you. So that's not going to add anything. It would just add side effects. So the procedure itself would be your tool, and then we would be combining that with the nutrition support, coaching, and everything else that we offer to make sure you get the most out of that tool.
All right, thank you. Elena, Dr. Merritt, this is for you. How long are your patients typically able to keep their weight off after the ESG procedure?
So that's a great question. Um, with the ESG procedure, we have long-term data at this point to support that patients are able to maintain their weight loss in the long term. So 5 to 10 year studies showing that the weight can be maintained and stay off for that period of time, and the ESG is effective for the long term.
Okay. Dr. McGowan, Vanessa, there is one, two, three, four, five bullets within her question. So let me try to throw these out here in sequential order. The first one is, what is the minimum number of sutures used in an ESG procedure?
Okay. Uh, in our program, 7 to 8 would be frankly, our minimum. This is really, really important. If we're talking about technique of ESG, the ESG is a really unique procedure. It's completely dependent on the technician, the doctor performing it, the number of sutures, the suture pattern they're using.
Mhm.
That really affects how well it will work. Absolutely, not every ESG is created equally. And so if you look at just the number of sutures, I mean, this is a common sense, like, it has to pass the common sense test. We're taking that stomach that we said is a football, making it into a banana. I think the more sutures, the better. The stomach's a really strong organ. So we really want to suture this down so that over the course of the next 6 weeks, it will heal and remain in that smaller shape. So if you have an ESG with 3 sutures or 4 sutures, it's not going to be as strong and in fact won't be as effective. So in our program, 7 to 8, if you're a taller individual, you might need more. Stomach size relates to height primarily. In a rare instance, we might use less, but in general, we're going to try to put as many sutures as we can because we want to give you that best tool possible.
Okay.
That's
Uh,
next bullet.
yes. What are the main drawbacks or limitations of ESG?
You want me to field that one?
Yes, I
Okay.
might as well stick with you on this individual.
Yeah, that's great. Every procedure has pros and cons, so I appreciate the question. And no procedure or treatment's perfect. So I would say, in terms of downsides, there's one main one. If you're comparing this to a surgery like a gastric bypass or a vertical sleeve gastrectomy, the weight loss is lower. It's close, but it's not quite the same. So, as far as the tool itself, a true surgery will drive more weight loss. That would be the biggest advantage of surgery. And if I would call it a disadvantage. The other disadvantages of ESG right now, to be frank, it's not covered by insurance yet. And we know that that is limits access for some patients. So Chuck talked about financing and other paths that most of our patients will utilize, but for right now, it's not covered by insurance. The third disadvantage is availability. There just aren't a lot of highly specialized ESG providers and facilities right now throughout the country. And that is why you have to do your research about number of sutures, about things like that. It's just really important to vet the provider that you're seeing.
Okay, well, thank you. I'm going to continue on with these bullets before we get to the next questions. What does post-operative care typically involve?
So there's immediate care, and then there's that year afterwards. I mean, I guess I can touch on all of that briefly. So right after the procedure, as Dr. Merritt mentioned, you will go back home or to your hotel, you'll recover. We see you the next day. Actually, you'll come to a hydration facility where we'll give you some IV fluid. That's going to really help you bounce back as quick as possible, avoid dehydration, and then you're on your liquid diet for the ensuing weeks, and then you'll transition towards your solid foods, working with a dietitian along the way. That's really going to be your support as we look at the next year. So you'll recover fast from the procedure, but then you're working with your dietitian and a health coach. Numerous visits. These are all virtual. They might be quick check-ins. It might be text message, virtual visits, phone calls. It's going to be a combination of what works best for you. But I think we have something like 20 to 30 touch points over the course of that year to make sure you're on track. Everyone's different, so it's not easy. And we have to work with you and help adapt your plan to you. And so that's the general protocol.
I'll share some of these bullets with you, Dr. Merritt.
Thank you.
Have patients reported loose skin after ESG?
So that can be an issue that comes up with any large amount of weight loss, is that the skin can be loose after a person loses a significant amount of weight. We like to wait at least 6 months before we recommend considering a cosmetic procedure to remove some of that loose skin, just to give your body a chance to sort of level out from your weight loss. And, during that time, again, we really recommend as much exercise as possible to really build your muscle. That's going to give your skin as much tone as possible and try to maintain your musculoskeletal health as you're going through your weight loss journey. So if you did find yourself with extra or loose skin that you wanted to be addressed, that would be by a cosmetic or a plastic surgeon at about the 6-month point.
Okay, and to continue with you, Dr. Merritt, on the last bullet here, is there any required preparation or pre-op protocol before undergoing ESG?
So I think Dr. McGowan did a great job touching on this earlier, that one of the great things about the ESG is that there is no preparation in terms of, long-term liquid diets or anything like that. Basically, you continue life as usual leading up to the procedure. The day before, you do follow a clear liquid diet. And the reason for that is just to allow the system to decompress and make sure your stomach is empty. And we do have you take some bowel prep medication, which also, just flushes the system and gets you ready for your procedure. But other than that, there's no involved preparation.
All right. Dr. McGowan, this is an anonymous attendee submitting this, and the question is, if the BMI is above 50, is ESG feasible?
Thank you. By the way, thanks to everybody for these questions. There's so many questions coming in, so we're really doing our best to get to all of these. So yeah, keep putting them in the Q&A section. Technically, ESG procedures are FDA approved for a BMI between 30 and 50. We can go outside of that range in certain instances. It will be practice and program dependent. For instance, our centers, the surgery centers that we work out of, generally will have an upper limit for BMI of 50. That's quite standard within the field in ambulatory settings, non-hospital settings. So right now in our program, for someone who's maybe slightly above that or on the cusp, we can work with you to help you get a little bit below that if it's your desire to have ESG. But from a purely technical standpoint, yes, ESG can be done for patients above 50.
All right. This one is for you, Dr. Merritt, from
Mhm.
Tiffany. What is the typical diet immediately post-procedure?
Thanks for the question, Tiffany. Immediately following the procedure, the day afterward, you follow a clear liquid diet. Um, then the next day, so 2 days after the procedure, is when you start your full liquid or protein shake diet, as it's referred to. During that protein shake diet, you are consuming only liquids in the consistency of like a protein shake. We recommend varying the flavors and types of protein shakes to keep it interesting. But that's basically the gist of what you consume for the first 6 weeks while your stomach is healing. And actually, the liquid diet during that time period is extremely important because what it does is it allows your stomach to heal in the best way possible. It allows the folds of the stomach that are brought together with the sutures to fuse and fibrose. And once your body creates that fibrosis almost like scar tissue, that's what makes your new sculpted stomach strong and long lasting. It gives you the most bang for your buck, so to speak, and also allows you to heal in the safest way possible. So it's that protein shake diet for a long 6 weeks, but we do have tips and tricks to keep it interesting, and then after that, you can incorporate regular solid foods.
Thank you. Great questions here. Dr. McGowan, here's one from Kim. The sutures is the hot topic of the questions coming in now, but this one is, how do you know if the sutures are secure or if they loosen? And the second part of her question is, will you experience constipation afterwards?
Okay. Constipation question first. Most likely, yes, you will. It's really, really common. The medicines we use to prevent and treat nausea slow down your colon. You'll be constipated. You're not eating anything in the beginning as well. Maybe you're a little dehydrated. We'll encourage you to use a stool softener like Miralax just to keep things moving. But it's really, really common. We just have to be prepared for that. Not everybody will experience it, but then things will return to normal, especially once you get to regular food and you're eating fiber again and all of that. Okay. By the way, someone wrote, "Can I talk louder, please?" Can you guys hear me? Okay. Is it okay? All right.
Yeah.
So sutures, will they loosen or how do we know? All right. So here's the thing. The suture material we use is extremely strong. 2O-proline is what it's called. You really couldn't break it if you tried. So we really don't want patients to worry too much about that. We're making sure our technique is perfect so that the sutures remain in place as that stomach heals, as Dr. Merritt explained. Something happens over time, though. Once the stomach fibroses, heals into that smaller banana-like shape, the sutures will gradually loosen. That's normal. There is no way that suture material can stay in the body tight permanently in any part of the body forever. If you think about if you cut your skin and have a suture placed, if it wasn't removed, eventually it would just loosen and fall out, but the wound wouldn't open back up again. So the same thing is happening with the ESG. Once those sutures have done their job, they've held everything in place, over the course of a year plus, they'll just start to loosen a little bit. They're in there, they're in the stomach, but they're not needed to hold it together. So that's a really important point. So if you have an ESG and 2 years later you have an endoscopy and you see suture material, I would say 100% normal because the stomach will still be smaller, but that's
Mhm.
just what it looks like at that point. We don't have to remove them. We just leave them alone. You don't know they're there. You don't feel them, but that's what happens.
And Dr. McGowan, you may touch on this just in case Elizabeth joined late, but her question was back since the sutures is a hot topic in the thread here is what is the minimum number of sutures used in ESG surgery, even though it's a procedure? Do you want to address that again? I'm not sure how you want to do duplicate questions.
Yeah, well, I guess I can answer it slightly differently. As far as a minimum number of sutures, there's a lot of debate in the field about this, but the accepted standard in the United States, based on guidelines that we've developed, is a minimum of 6 to 8 sutures for an ESG. And our feeling in the field is that below that, it's just insufficient because then we're asking too much of each of those sutures, and we can't expect them in every circumstance to hold that stomach as it heals over the next 6 to 12 weeks. Also depends on who's doing the procedure, and not all sutures are placed in the same way. So in our program, all of our doctors use the exact same technique. We all train together in the same processes, and we have like hundreds of studies supporting what happens when you use these techniques. So we know they work in terms of number of sutures and suture pattern. But as far as a minimum, 6 to 8 is the US accepted standard.
Okay, thank you. All right, Dr. Merritt, this question is from Lisa. How do you determine which treatment is most appropriate, ESG versus balloon versus GLPs, or perhaps a combination of two modalities?
Thanks for the question, Lisa. So that's a great question, and every patient's treatment should be individualized. So for some people, looks like one modality; for others, looks like a combination. I would say, I'll take this opportunity to really distinguish between the way that I select patients or make recommendations for the intragastric balloon versus the ESG stomach tightening. And, we want to always consider your goals. So are you looking for a permanent, durable, long-lasting procedure? If so, ESG is the clear winner. If a person, however, has maybe had some life circumstance that caused them to gain weight, that, say an injury or a pregnancy, or, patients have all kinds of things that come up where maybe they gained an extra 30 to 50 pounds and want to use a tool that's reversible to get back down to their baseline weight. And so that's where the balloon can be a really perfect option for somebody in that scenario. Again, just keeping in mind that the balloon is reversible, where after 6 months we go in and remove the balloon, versus the ESG is a one-time, same-day procedure that is long-lasting and durable and lasts for 10 years or more. We really consider, has somebody had a lifelong weight struggle, where that long-lasting approach is going to likely be more beneficial. And I find that most of my patients fall into that boat, where really the ESG gastroplasty is the clear winner.
All right. Dr. McGowan, question from Jamie. Does the ESG stomach tightening have acid reflux as a side effect?
Okay, Jamie. Yeah, important question, because that is one of the key differences with a traditional surgical sleeve. We know with surgery, when you create a sleeve, it's a really tight tube and it sort of wicks reflux straight up. So that's the biggest side effect with a laparoscopic or surgical sleeve. About 1/3 of patients will have significant acid reflux. It doesn't really happen with ESG, and we actually don't really see this, and not just anecdotally, based on the clinical studies, we know that patients don't develop reflux. It has to do with the shape of the banana that we're creating. It's not quite as much of a tube, it's more like scrunched down, a different shape that we're creating through the suturing, and it's what we call a low pressure system. So acid will naturally exit the stomach rather than come right up and reflux. So we really don't see it. What we tell patients is, if you have existing acid reflux, most likely it will get better because you're losing weight. Worst case, it will stay the same. That's not a bad thing necessarily. Mm-hmm. If you have a hiatal hernia, if it's small to medium size, we can do the ESG procedure. That's not a contraindication. Again, a difference from surgery. So it's really unusual, actually, to hear someone describe reflux that develops after an ESG.
Okay. Dr. Merritt, anonymous question. Hello, want to get rid of sleep apnea? That's it.
I'm glad you're here. I think that sleep apnea is a really important comorbidity that along a lot of times coincides with obesity, just like so many other comorbidities. I mean, diabetes, high blood pressure, all of the things that we see as sort of results or comorbid conditions along with obesity. And that's why we're here on this weight loss webinar, to give you some information about hopefully which procedure or which modality is going to be right for you to help lose some weight and achieve weight loss, which will hopefully then translate into better control of sleep apnea, or hopefully reversal of sleep apnea.
Okay, and Dr. Merritt, another one from Judy. Could you address, if any, hair loss?
Thanks, Judy. That's a really great question, and is really an opportunity to highlight that with the ESG gastroplasty, the ESG stomach tightening, we are not rerouting your intestines, so to speak, like some of the surgical options. So we are not creating a scenario where you're at risk for malabsorption or vitamin or mineral deficiencies. And that can be part of why a person experiences hair loss after after a weight loss procedure or surgery. So we recommend, supplementing your program with a multivitamin, just to make sure that we're sort of just bolstering your vitamin and mineral stores to support hair growth and all of those things. But as a result of the procedure specifically, there's no reason why it would cause hair loss. Now, with that being said, when a person does experience rapid weight loss, sometimes part of the body's stress response can be that patients may notice some hair loss. And that, again, in the setting of pretty quick weight loss is sometimes unavoidable, but we can do our best to mitigate that by again, recommending a good multivitamin and supplement, and just make sure that you're meeting your protein goals and following the post-op program really closely.
Okay, I'm going to stick with you, Dr. Merritt, on this.
Yes.
Anonymous question, Dr. Merritt specifically. What
Okay.
if you need to lose much more than 18%?
That's a great question. So, depending on your goals, we tailor the therapy. So, an ESG gastroplasty on average is going to get a person the 18 to 20%. We certainly see patients who take their ESG stomach tightening and run with it and lose way more than that, because they really are so dedicated to their robust program with their diet and lifestyle, and really sticking with it for the long term. So we've had patients lose over 100 pounds after an ESG. So it's just about, helping support you in line with your goals. And like Dr. McGowan talked about earlier, we certainly, in the setting of much larger amount of weight to lose, we can certainly augment your progress, your program, with like a weight loss medication as well, if that were to be indicated.
Okay, thank you. All right, Dr. McGowan, question from Sharon. What if you currently have fibroids and need ESG procedure to lose weight to have a hysterectomy? Does ESG help with sciatica and knee pressure to help lose weight?
Yeah, this is a really common thing that we hear from patients, which is, I'm interested in having a procedure to have maybe another surgery. Oftentimes it could be an orthopedic surgery, knee replacement, back surgery, or anything like a hysterectomy, gallbladder surgery, where maybe you just need to get down to a weight that the surgeon is more comfortable treating you at. So yeah, absolutely. One thing we would talk about is timing. Of course, how urgent is the need for that surgery? Because it's going to take some time to lose weight. So that's something that we want to think about. Usually after the ESG procedure, you could have another procedure or surgery within 6 weeks or so. That's pretty standard, or vice versa. So we have some patients who have their hysterectomy and wait 6 weeks and then have their ESG. So that would be a conversation that when you have a consult, we could discuss and kind of talk through the best path.
And why I'm still with you, Dr. McGowan, maybe readdress, is there a max BMI? Another question about that. I know we addressed it, but maybe throw it out there in case we have any late comers.
Yeah, just currently in our program, the upper limit is 50 because of the upper threshold of the surgery centers that we work in, the ambulatory centers. But as I had said earlier, FDA indication is 30 to 50 if we're following that.
All right. Chandra, this is a question for Dr. Merritt. I can't fathom my stomach being the size of a banana because my imagination is so vivid. Will I have to take vitamins and or minerals after my ESG for the rest of my life and stool softeners?
Absolutely not. You won't be required to take any of those things long term. As we alluded to before, immediately following the ESG, most patients experience some degree of constipation. So the stool softener really helps keep you more comfortable and get you through those first couple of days or weeks where a person might be experiencing constipation. Once you're back to your normal solid food diet and you're eating fiber, that constipation should fully resolve. There's no reason why that would be a long-term issue after the procedure. And related to the vitamin mineral deficiency question, again, we touched on that earlier, but just during that 6-week period when we have you on the protein shake diet, it can be a really good idea to support your body with a good comprehensive multivitamin. if you choose to stay on that long term, certainly lots of people do like to take vitamins regularly, but there's nothing about the ESG that requires you to have to do that forever.
Thank you. I'm going to take this quick one, and it's a question from Jamie of, do we take insurance? We currently do not take insurance, but if you call the toll-free number or register on Bariendo.com, you can speak to one of our patient navigators. We have great financing options with Care Credit and Cherry. Both are fantastic. And even Cherry, depending on your credit score, which again, I can't go into that specific realm of what the score needs to be. But if you do have a great credit score, some of the percentages are close to 0%. So hopefully that helps, Jamie. Okay. Um, Question from Judy, and I'm going to answer this one as well. And it's, who are the Nashville folks? I'm assuming you're interested on who the physician is in Nashville, Tennessee, and that is Dr. Zach Callahan. Dr. Zach Callahan is the Nashville physician. Hopefully that helps. All right. Uh, um, this one is from Alan, Dr. McGowan. I want interested intragastric balloon for getting rid of sleep apnea. Have Hashimoto's, hypothyroidism, and suffering from low T testosterone. Endocrinologist prescribed testosterone shots.
Okay, that's it. All right,
That's it.
we can knock out your whole consult based on that history. Thank you. I mean, the fact is, this is sure, you could be a candidate. We know that the amount of weight you'd lose, 10 to 15% of your body with a balloon, should greatly help sleep apnea. But this is a question that, again, we want to talk to you individually and really understand the full picture to see if that's the best path for you. And it certainly may be. But we may also explore another path that might be better long term. But yeah, the balloon can help you drive that weight down. If your goal is to improve sleep apnea, absolutely. By the way, if I could touch quickly on the insurance question. This is something we're working really hard on in the field, is to get insurance coverage for the ESG procedure. It's not our, choice to not take insurance. It's just not available right now because just field wide, there isn't even the code yet for the procedure. But something we're hoping in the not too distant future will arrive. So I just wanted to be clear about that.
Thank you. Thank you. Dr. Merritt, anonymous question. What is the average weight loss for postmenopausal women over 55 years of age?
That's a great question. So, when we look at averages with related to the ESG stomach tightening, so the 18 to 20% is really the average. I know at Bariendo, we can, depending on their starting BMI with their comprehensive program, can really help get folks even more weight off than that. But in terms of specifically for a postmenopausal patient population, I don't know that we have that data available. So I don't want to, make up numbers, but we don't have any reason to think that it would be drastically different from those average numbers in terms of the amount of weight that we would expect you to lose. And Dr. McGowan, I don't know if you have anything to add to that.
Yeah, I completely agree. It would be the similar averages. There's some very small studies that, basically show it's pretty much the same. So yeah, great question though.
Dr. McGowan, question from Tiffany. Who is the doctor in Houston and what is his or her experience with ESG?
Oh, that's Dr. Julian Fahed. He's fantastic. I was with him not too long ago, and we had a great day with patients. And yeah, he's tremendous. Incredibly skilled endoscopist, which, as I mentioned earlier, is really critical. Also a great guy. Yeah, it's a great team there. I have to say, just in my role, traveling around to different centers here with Bariendo, our teams are really, really fantastic everywhere. So one thing I can say confidently is you have a really excellent experience on procedure day.
Thank you. I'm going to stick with you, Dr. McGowan, on this question from Nicole. What if we still need support after 1 year?
Yeah, absolutely. I mean, when nothing changes at a year, like this is a lifelong battle in many ways. It's we're fighting the condition of weight and obesity. So we have to put a cap on things just as a program. So we set 12 months as kind of the standard in the field. But beyond that, if you said, you know what, I'm having an amazing time working with my dietitian, I want to continue to do so, we will do that. You know, we want to make that available to you. So we have definitely many patients who extend their care beyond the year, and that's something that we can help set up for you.
So maybe on that same context, Karina just sent one in, well, not just because they're piling up. Can you explain the year-long support and what is included? It kind of ties in for during the first year, and then they were asking after.
Yeah, yeah, I touched on that a little bit before, but just to be brief, you will work with a health coach for a full year. That's actually going to be your main support individual. You'll work with a registered dietitian throughout that year. You have your medical team, which is your doctor and nurse practitioner or our APP team. And so that's your core team, and we're all there supporting you for that year. We have a structure to the follow-up, a certain cadence, but everyone's different. So some patients will want to meet with us more. Some may say after a while, you know, I'm good for now. They might want to back off. We don't encourage that, but we have a general structure for that year. And I will say, yeah, the questions are piling up a bit.
Yeah.
I don't know if we want to do like a speed round. We've got about 10 minutes left. We can try
I think
to
there's a
knock
lot
out.
of them.
There's a lot. Yeah.
There is a lot of
Thank you,
them
everybody.
here. Okay, Dr. McGowan, let me just stick with this. Brian, how does this affect your gut health? I've heard a lot of things about how important your gut is for your overall health. Does this help improve things? Does it also help with things like reflux, which we have covered? Yes.
Yeah, we talked about reflux, gut health. Yeah, the gut is a powerful organ, and what we know is we're really just altering the stomach. So we're not changing anything permanently with the gut, meaning the intestines. This is very different than like a gastric bypass, where everything's different afterwards, and you can have those long-term side effects. So we know the short term, there's some constipation. We do have patients who have irritable bowel syndrome, like diarrhea, predominant irritable bowel, who will describe longer term improvement. I've heard that many, many times anecdotally, so that might be some long-term benefit. But since the nutrition component is still the same after the procedure, you can maintain that same healthy gut.
Okay. Quick one, Dr. Merritt. Sharon, after surgery and after healing, the eating portion, is it a very small portion? And then after your procedure, is your throat tremendously very sore?
Rarely I'll have folks report that they had some sore throat maybe that evening. And sometimes that can be from the anesthesia, the breathing tube. On occasion, it can also be from the endoscope passing, down through the back of the throat there. So if that were the case, I mean, just kind of lozenges and tea, and that's resolved within 24 hours. Um, and what was the other part of the question? There was the sore throat and the,
Sore
oh,
throat
portions.
and portions, yes.
So absolutely, the goal of the ESG stomach tightening is just like it sounds. Your stomach will be smaller and tighter after the procedure and sort of mimic the shape of a banana or just kind of a scrunched up, smaller stomach. So absolutely portions will be and should be much smaller after the procedure compared to what a person ate prior to. But in terms of quantifying that, it's every person's different. So I would just imagine that certainly portions should be smaller. Now, that being said, I'll just distinguish the ESG from, for example, a Roux-en-Y gastric bypass, where the stomach is literally the size of a golf ball, sometimes smaller. So I mean, those portions can be so drastically reduced, where sometimes folks are eating one bite of food and that's their meal, so to speak. So the ESG, you absolutely have lots more flexibility and a much more a much more doable size stomach, if that makes sense in terms of enjoying a meal. It'll just be instead of like this, like this.
Okay, Dr. McGowan, can you speak to the risk of infection?
Absolutely. That would be in the less than 1% realm, actually quite a bit less than 1% of the rare side effects. That's near the bottom, but it is a procedure. We are suturing, so every patient receives a dose of antibiotics at the time of the procedure, not beyond that, so just one dose. And of course, we'd monitor you for fever or any other side effects. So quite rare.
All right. And Dr. McGowan, Alan is asking, how long after my initial contact with you can I have my procedure done? Do I have to wait for months?
Hopefully not months. We want to work on your timeline, definitely. The process in our program would be you reach out to us. You may speak to one of our navigators first, or you may come straight to a consult, meet with one of our doctors or advanced practitioners, and we're going to, of course, make sure working with you that this is the right procedure for you, whichever it is that you're interested in. And then when we say medically you're eligible, usually we're looking at 3 to 4 weeks minimum. We don't want to rush into anything, but we do just a little bit of evaluation beforehand, basic labs, depending on your health history. We're going to set you up with the medicines you need for the recovery. We're going to get everything in place. We just want you to feel fully prepared. So we don't want to rush, but 3, 4 weeks would be kind of the average on the short side. If you said, I want to do this next summer, we can accommodate that.
Okay, Dr. Merritt, we're going back to the hot topic of number of sutures. This is a big one.
Okay.
Since the sutures used during ESG aren't visible externally, how can patients know how many sutures were placed? And is this information provided after the procedure?
Great question. So yes, absolutely. So the number of sutures that we use at the time of the procedure is detailed in our documentation. So it can easily be seen in your procedure report. Hopefully, where you get some pictures, you get a description of the procedure, and it'll say exactly how many sutures were placed.
Okay, Dr. Merritt, can you take birth control, multivitamins, or iron supplements during the 6-week liquid diet?
Yes.
Okay. Dr. McGowan, this comes from Mako. Is it common for a person to need a repeat ESG in their lifetime? Thanks.
Not common, but it's something that can be done. That's actually an advantage of ESG is it can be repeated, it can be retightened if ever needed. And that's true of any surgery. Like some patients might need things tightened again. Again, no shame in that, as I said earlier. So we can do it. Percentage wise, it's pretty low. With a well done ESG, it's not something you should need. Um, by the way, getting back to the suture numbers, we're so obsessive and nerdy here that we don't just document the number of sutures, we document the number of stitches per suture in your report. And so we'll say like we used 85 stitches, and you'll get all these numbers with the report.
Okay, Dr. McGowan, this one's a good one. Delisha, hopefully I'm pronouncing that properly. I did a consultation with a doctor in Canada, and he said ESG is reversible and he sutures the fundus. Is that a red flag?
Um, I wouldn't call it a red flag necessarily. That gets into some real procedure technique discussion. We typically avoid the very top of the stomach, which is called the fundus. It's just a higher risk area. Now, a very experienced endoscopist might go a little bit higher in the stomach, but we don't know that it improves weight loss. We do know it increases risk. It's just close to a lot of different structures, and it's a really thin part of the stomach. Is it reversible? It depends on the time frame. As we talked about many times, we're trying to use the sutures to help the stomach heal into its permanent shape. At that point, it's really not reversible. I would say it may be partially reversible if you were to cut the sutures, but really it's still going to hold that smaller shape.
Okay, Dr. McGowan, I'm giving this one to you from Chandra, and I'm going to answer amazing, but I'm going to let you add on to that. I'm scheduled for an ESG in Washington, D.C. on January 5th. Thank you so much. I am so excited. Is the DC physician awesome also?
Amazing. That's right. Dr. Laster's fantastic. So, yeah, you'll love her.
Yes. Okay, anonymous one, Dr. Merritt, what is the typical pain level following the ESG procedure? How soon can I return to work?
Pain is common after the procedure, and less so, pain more, it's described as a burning or cramping, and a lot of folks will feel it kind of just right here, right where the stomach is. And that will last for, on average, 24 to 48 hours. We give you tools to work through it. We give you medications to help get you as comfortable as possible during that healing phase. But certainly, some cramping, and your stomach is adjusting to the sutures that were just placed. So that is something that we talk about beforehand. When can you return to work? We generally say within 3 days. Most folks can return to work. Now, barring some exception where a person has a really physical job or other circumstances that might require you to be out for longer, 3 days is about average.
Okay, we're up to the hour, but let me throw this out to you, Dr. McGowan. Hopefully I'm reading this. What type of anesthesia is used, and is there an anesthesiologist on board? I'm assuming that means in the procedure room. I'm assuming.
Sure. Okay. Yeah, we are at 9 o'clock. So I'll field that question. Maybe we can wrap after that. By the way, thanks everyone for hanging in there for this hour. This has been amazing. We have a lot of questions we didn't get to. So what we may do is on social media, we may answer some of the remaining many questions that weren't answered, but thank you all. As far as anesthesia, this is general anesthesia. If we're talking about the ESG procedure, general anesthesia, it's really propofol is what we're using primarily. If you've had a colonoscopy or endoscopy, it's the same medicine. Our procedures take about 45 minutes to an hour, and then we just turn off the medicine and you'll wake up. And there is an anesthesiologist on staff and in the facility typically during all of our procedures. So yeah, you have an anesthesia provider in the room with you, monitoring you. So let me just post a little something here as we wrap up. Again, thanks everybody for joining us. We are Bariendo. If you need to learn more, want to, you can visit our website, or if you wanted to have a consultation, you can scan this QR code and you can connect with our team directly. And thank you so much, Dr. Merritt. Thank you, Chuck. Thanks for hosting.
Thank you, everybody.
And everyone have a great evening. Thank you.
Have a good night.
Thank you.
Bye, everybody.